It's one of those things that happens in an instant. One moment, your dog is just being a dog, playing, maybe sleeping, and the next, they're on the floor, and your whole world just stops. It is one of the most terrifying things any of us as pet owners can ever go through. And if this has happened to you, you know exactly what this feels like. It is pure, cold terror. You feel so helpless just watching your best friend like that and not knowing what to do. Your heart's pounding and a million questions are racing through your head. What was that? A seizure? Did they just faint? Are they okay? You know, the uncertainty in those moments can feel completely overwhelming, but understanding what you just saw, that is the first and most critical step to getting them the right help. So let's walk through this together. My goal here is to help turn that confusion into confidence, so you'll know exactly what to look for and what to tell your vet next. Okay, so let's dive right in. The very first thing to get our heads around is that even though they can look scarily similar, fainting and seizures are actually caused by two completely different problems happening inside your dog's body. Let's start with syncope. That's just the medical term for fainting. See, this is a circulatory issue. Think of it like a brief, sudden drop in blood pressure or oxygen that causes a temporary lights-out moment in the brain. A seizure, though, is a neurological event. It's like a sudden, chaotic electrical storm inside the brain that makes the body move uncontrollably. So you've got a circulation problem versus an electrical problem. That's really the key difference right there. So how in the world do you tell them apart when it's happening? Well, this is where you become the most important person in the room. Seriously, what you saw, that is the single most valuable clue for your veterinarian. Okay, so from a bird's eye view, the biggest clue is usually in the timing. A fainting spell is kind of like a light switch being flipped off and then right back on again. It's super sudden and the recovery is really fast. A seizure, on the other hand, often has a sort of build-up and then a much longer, slower recovery period. All right, let's break an episode down into 3 key phases: before, during, and after. The differences here are huge. Before a dog faints, there's almost never a warning. It just happens. But before a seizure, you might see what we call an aura, where your dog gets anxious or tries to hide. Then, during the event, a fainting dog usually goes totally limp. But a seizing dog, their body often stiffens up with those jerky paddling motions. And probably the most telling clue of all is what happens after. After fainting, they're pretty much back to normal in a minute or two. After a seizure, that confused, out-of-it state can go on for hours. So you might be asking, what's really going on under the hood to cause these things? Well, the absolutely easiest way to think about it is with a little analogy I like to use: plumbing versus electrical. When we talk about fainting or syncope, I want you to think of it like a plumbing problem. It's an issue with the body's pipes and pumps, the whole circulatory system. There's a temporary drop in pressure, and blood flow to the brain gets cut off for just a second. Now, a seizure, that's an electrical problem. It's basically a short circuit in the brain's complex wiring. Abnormal electrical signals start firing like crazy, and that's what causes the physical episode we see. So what kinds of things can cause these plumbing issues? Well, most of the time it's an underlying heart condition, like an irregular heartbeat or a problem with a heart valve. But it can also be situational. Things like a really harsh coughing fit, getting way too excited, or even a dog pulling too hard on its collar can actually trigger a fainting spell. And on the flip side, what about those electrical problems? The most common cause of seizures in dogs is something called idiopathic epilepsy, which is basically an inherited seizure disorder. But seizures can also be triggered by other things, like exposure to a toxin, or even problems with the liver or kidneys that end up affecting how the brain functions. All of this information builds to what I think is the most important part of this whole process: your role. When you walk into that vet clinic, you're not just a worried pet owner. You are the chief detective on this case. And I know this might sound like a stretch, but honestly, a huge part of getting the diagnosis right, maybe as much as 80%, comes down to the detailed story that you can provide. I mean, think about it. By the time you get to the clinic, your dog is probably acting totally normal again. So what you saw at home is the most critical piece of evidence we have. So God forbid this happens again, here's your mission. Number 1, note the trigger. What was your dog doing right before they collapsed? 2, time the event. I know it feels like forever, but try to see if it was 30 seconds or 3 minutes. And 3, carefully observe the recovery. How did they act in the minutes and even hours after? And to help you get ready, just start thinking about these key questions your vet is absolutely going to ask.
Did they seem totally out of it, unconscious? Was their body stiff, or were their legs paddling? Did they happen to urinate or defecate during the episode? And that crucial one, were they confused and disoriented afterward? Having those answers ready is so helpful. But you know what? Here is the #1 most powerful tool you have. It's the camera on your phone. If it is safe for you to do so, please try to get a video of the episode. A short little clip can tell your vet more than any description ever could. It is the key to a fast, accurate diagnosis.
Okay, deep breath. I know this is a ton of heavy information, and it's a really scary topic. But I want to end this on a note of hope, a note of control. Because once we figure out what we're dealing with, there is absolutely a clear path forward. Listen, getting the right diagnosis, that's the whole ballgame. From there, the treatment is totally tailored to whatever is causing the problem. For a heart-related fainting issue, that could mean heart medication, maybe even a pacemaker. For epilepsy, it could be anti-seizure meds. The plan will be unique to your dog, but the goal is always the same, to manage the condition and make sure they have a happy, wonderful quality of life. So look, if there's just one thing you take away from all this, I want it to be this. In that moment of absolute panic, your calm observation is your superpower. What you see, what you remember, and what you record can directly lead to a clear diagnosis and a healthier, longer life for your best friend. Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.